Hello friends, today in this lecture we are going to talk about concept related to increase in glomerular filtration rate, increase in GFR due to increase in blood glucose level. So this concept is pretty much similar to increase in GFR due to increased consumption of proteins. Now, if you have watched the last lecture about increase in GFR due to increased consumption of proteins in diet, then you need not to watch this lecture because this is almost the same. The increase in GFR due to increased blood glucose level is almost the same as the increase in GFR due to proteins. So we will be repeating the same old lecture, but this time for glucose. So how the increased blood glucose will increase the GFR. Now we will quickly revise all the old things which we have discussed so many times in the last 5 to 6 lectures. Now, the human kidneys, both the kidneys are filtering the fluid, and the fluid enters the nephrons through the afferent and efferent arteriole. The filtrate then moves from the Bowman's capsule through the proximal tubule, then the loop of Henle, then the distal tubule. And then the urine formation process completes and the urine is go out of the human body. But the point at which the distal tubule comes in close proximity with the afferent and efferent arteriole, when this area is cut down, this area look like this diagram. This portion of the distal tubule, afferent, efferent arteriole and Bowman's capsule, or when it is cut like a section, it look like this diagram. Here is the distal tubule, here is the distal tubule, here we have the afferent and efferent arteriole, the glomerular capillaries and the Bowman's capsule. Now, with the help of these diagram and with the help of tubuloglomerular feedback mechanism and these curves of auto-regulation of GFR and renal blood flow, we will be able to determine the increase in GFR due to increased blood glucose level. Now, whenever the amount of sodium in the distal tubule decreases, it is detected by special cells, the macula densa, which are present in the distal tubule. So here, the distal tubule, here we have the macula densa, which has been shown here in the red color. So macula densa senses the amount of sodium in the distal tubule, and according to the increase or decrease in concentration of sodium chloride in distal tubule, the macula densa will pass some signals which will either increase or decrease the GFR, which is the basis of tubuloglomerular feedback mechanism. And this tubuloglomerular feedback mechanism basically is responsible for auto-regulation of GFR and renal blood flow, which states that the GFR and renal blood flow are kept nearly normal. They are kept in the normal range or nearly normal range despite of changes in the arterial pressure. So the human kidneys are equipped with this system in which they are able to maintain normal level of glomerular filtration rate and normal level of renal blood flow, or almost or nearly normal level of the GFR and renal blood flow despite of changes in the arterial pressure. But when very big change occurs in the arterial pressure, then GFR may drop and renal blood flow may drop, but they are maintained nearly normal, in this nearly normal range even with changes in the arterial pressure. This is the auto-regulation of GFR and renal blood flow. Auto-regulation is maintained with the help of tubuloglomerular feedback mechanism, myogenic auto-regulation and some other processes. Now, the tubuloglomerular feedback mechanism for auto-regulation we have explained so many times in the last 2 to 3 lectures, but I will revise it quickly once again. When the arterial pressure decreases, it leads to decreased glomerular hydrostatic pressure. I have a diagram to show you. Here it is. Now, here we see when the arterial pressure decreases, this is the glomerular capillary and the Bowman's capsule. This area has been basically enlarged. These are the glomerular capillaries in the Bowman's capsule. So when arterial pressure decreases, the glomerular hydrostatic pressure drops. When the glomerular hydrostatic pressure drops, what happens is that the filtrate starts moving slowly. When the filtrate starts moving slowly, the sodium is absorbed more. More sodium is absorbed in these tubule as compared to normal amounts which are absorbed. So for example, filtration occurs here. These are different diagrams which I have explained so many times in the last few lectures, but this is the last topic of this chapter, so I am explaining it again, that when filtration occurs, filtrate moves in the nephron tubule, but some of the substances are reabsorbed from the proximal tubule into the peritubular capillaries. So sodium is also absorbed, and especially when the arterial pressure has decreased, more sodium is absorbed from the proximal tubule into the peritubular capillaries. When more sodium is absorbed in the proximal tubule, this lecture may seem haphazard due to these different slides, but you should focus on it. You should focus on the concept that when more sodium is absorbed from the proximal tubule, the amount of sodium concentration, the concentration of sodium in the loop of Henle and the distal tubule decreases. When it decreases, this area, the macula densa senses this decrease in sodium concentration, and it starts sequence of events which leads to a decrease in the afferent arteriolar resistance, decrease in resistance of the afferent arteriole and increase in resistance of the efferent arteriole. Now, you see, the resistance in the afferent arteriole decreases and efferent arteriole increases due to the signals started by macula densa. So, when the resistance in afferent arteriole decreases, more fluid start entering into the glomerular capillaries, glomerular hydrostatic pressure increases and GFR increases. Similarly, when slight increase in the efferent arteriolar resistance occurs, it also leads to increase in glomerular hydrostatic pressure, increased filtration and increased GFR. And this mechanism is known as tubuloglomerular feedback mechanism. Because of low sodium chloride concentration in the distal tubule, it starts signals from the macula densa cells, which leads to decrease resistance in afferent arteriole and increase resistance in efferent arteriole, both of which favor the increase in glomerular hydrostatic pressure, and due to increase in glomerular hydrostatic pressure, the filtration increases or the GFR increases. Now, this is the basis of low arterial pressure, which actually give rise to or which leads to decrease in sodium chloride concentration at the macula densa. Now, how the increased resistance and the decreased resistance leads to high GFR. With the help of these curves, we have explained so many times in the last lectures that decreasing resistance of the afferent arteriole, decreasing the resistance of the afferent arteriole will increase the GFR. Increasing the resistance of the afferent arteriole will decrease the GFR. In the efferent arteriole, if the resistance increases, the GFR initially will increase. It will not decrease. In afferent, when resistance increases, the GFR decreases. But in efferent arteriole, when resistance increases initially, the GFR increases. But with severe or very high increase in efferent arteriolar resistance, the GFR then may dip down. So both the signals started by macula densa, which leads to decreased resistance in afferent arteriole, and increased resistance of efferent arteriole due to angiotensin II, leads to high GFR. And high GFR leads to normalization of sodium chloride concentration at the macula densa. What happens in the high glucose intake and how high protein intake is that the amount of glucose and the amount of proteins, amino acids that are absorbed in the proximal tubule leads to high absorption of sodium along with glucose and amino acids. So when glucose concentration in blood is high, more glucose is entering the filtrate, and this glucose is reabsorbed into the peritubular capillaries. But when the glucose is reabsorbed, a lot of sodium also gets reabsorbed into the peritubular capillaries. Same is true for amino acids due to high protein intake. When protein intake is high, amino acid gets filtered into the Bowman's capsule, and then they are reabsorbed from the proximal tubule into the peritubular capillaries. And when they are absorbed, the sodium also get absorbed from the proximal tubule into the peritubular capillaries. Now, when a lot of sodium has been reabsorbed from the proximal tubule along with glucose or along with amino acids due to high protein intake, the concentration of sodium in the loop of Henle and the concentration of sodium in the distal tubule decreases. Now this decrease in sodium is sensed by the macula densa cells. It is sensed by the macula densa cells in the distal tubule, and the macula densa starts the same sequence of events which it started with decreased arterial pressure. And it leads to decreased resistance in the afferent arteriole and increased resistance in efferent arteriole. And both the factors basically lead to high filtration, and the GFR basically returns to normal. This mechanism is known as tubuloglomerular feedback, and this mechanism is basically responsible for the increase in GFR due to intake of high protein in diet or high blood glucose level in the blood. And the purpose of this tubuloglomerular feedback mechanism normally is the auto-regulation of GFR and renal blood flow. This system basically tries to maintain the normal GFR and normal blood flow despite of changes in the arterial pressure. But now in the auto-regulation, if the arterial pressure decreases, then tubuloglomerular feedback mechanisms get more active because of small or less amount of sodium concentration in the distal tubule. But if the arterial pressure increases, then the myogenic autoregulation gets more active, in which whenever due to high arterial pressure the blood vessels are stretched, the smooth muscles in these vessels, they constrict and they do not allow more blood to flow into the glomerular capillaries, and they rather try to increase resistance and prevent more blood flow going into the glomerular capillaries. And in a way, they are trying to normalize the GFR and renal blood flow. And both the autoregulation, either due to the tubuloglomerular feedback or due to myogenic mechanism, both are helpful in the GFR and renal blood flow maintenance. And in the same way, whenever sodium concentration in distal tubule decreases, even if it is due to the increased protein intake or if it is due to the increased glucose intake, it will start tubuloglomerular feedback mechanism. In both the conditions, the protein intake and high glucose in the blood will lead to increase in GFR or tubuloglomerular feedback mechanism activation. Thanks a lot for watching the video.